Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 367,395 cases. 2,883 new cases have been reported since yesterday. A record high 2,033 people in the hospital, and sadly, 5,284 people who've died. Our prayers are with those who've lost loved ones to this cruel virus. We're seeing cases and hospitalizations rise steadily, as are many states across the country. We're continuing to monitor the data and the trends closely. We need to keep doing what we know works, wearing a mask anytime we're with people from another household, and social distancing anytime we leave our homes. As concerning as the numbers are, I and many other North Carolinians have newfound hope in the development of promising vaccines. Moderna and Pfizer both have produced vaccines with remarkable early results, better than health experts ever hoped for. What we know so far is this: safe, effective vaccines should be available soon. Our job is to be ready to get them to people as quickly and effectively as possible. North Carolina is working hard to hit the ground running when these vaccines are approved and shipped. For months, our Department of Health and Human Services has been developing a plan to distribute the vaccines so that we can get past this pandemic. But there's still a lot of work to do to get the vaccines from the manufacturers to our health care providers like hospitals and health departments, and then ultimately to each of us. Our state is preparing to receive the Pfizer vaccine that requires ultra-cold storage. Healthcare providers with these capabilities have been identified across North Carolina. We're a big state, though, with rural areas that stretch for hundreds of miles. Every person is important, and we'll work hard to overcome the challenges that our geography presents. The COVID-19 vaccine will be free, regardless of whether someone has health insurance. Healthcare providers are being enrolled in the vaccination program based on their ability to reach priority populations, those who are at risk of exposure, like healthcare workers, and those who are at risk of severe illness. Trusted providers like hospitals and local health departments will be among the first to vaccinate people. These vaccines have made progress so quickly because of significant improvements in science and technology, all while following safety protocols. Researchers like we have right here in North Carolina have been working on new vaccine technology for several years in preparation for a global pandemic just like this. And when it comes to determining safety, before the FDA will authorize these vaccines, an independent advisory board will review the data for safety. This advisory board has no loyalties to any company, political administration, or individual. The board exists to review the vaccine trials independently. I have confidence in this process. Healthcare workers, people in long-term care, and those at risk for severe illness will come first. But when it's my turn to get this vaccine, I'll be ready to roll up my sleeve. At this time, I'm going to ask Dr. Mandy Cohen, our Secretary of Health and Human Services, to share more with us. Dr. Cohen.
Thank you, Governor. As you mentioned, our trends are worrisome. People are going to the emergency department more and seeing COVID-like illness. Our cases are at their highest levels since the start of the pandemic, and the percent of tests that are positive is up. Too many people are becoming seriously ill with COVID. Our hospitalizations have hit record levels with over 2,000 people hospitalized right now across the state. Sadly, more than 5,000 North Carolinians have lost their lives from this virus since our first death in March 12th of this year. To give some perspective, just under 1,500 people died from the flu in the past 10 years. In just 11 months, COVID has killed more than 3 times that number. These are more than trends and numbers. They're real people. With significant community spread across the state, anyone of any age can transmit COVID to someone who is at higher risk for serious illness. That's why our prevention tools, those 3 W's, are so important. Wearing a mask, waiting 6 feet apart, and washing hands often are proven to help prevent people from getting sick, keep people out of the hospital, and save lives. Fortunately, we are likely just a few weeks away from having a new tool that we've all been waiting for, a vaccine. COVID-19 vaccines will help us defeat this virus and get back to the people and places we love. Vaccines imitate an infection, so their bodies think a germ like a virus is attacking, and we make antibodies that we need to fight the real germs if they come and attack. The Food and Drug Administration and their External Advisory Committee will review 2 vaccines this month. Between those 2 vaccines, more than 70,000 people have participated in clinical trials to see if these vaccines are safe and if they can effectively prevent someone from getting COVID-19. The preliminary data looks very strong, and we look forward to reviewing the complete data when it's made publicly available in the next few days. Once a vaccine is authorized for use by the FDA, states will receive a very limited supply at first. To determine who should get the vaccine first, the North Carolina Institute of Medicine convened an independent COVID vaccine advisory committee. Our prioritization plan is based on their guidance, along with guidance from the National Academy of Medicine on equitable distribution of vaccines. Initially, this very limited supply of vaccines will go to a limited number of hospital settings to vaccinate healthcare workers at high risk of exposure to COVID-19, those who are caring for or cleaning areas used by patients with COVID-19. As more vaccine becomes available, we'll be able to have vaccine distributed to more of the state's hospitals and then to our local health departments to focus on vaccinating our high-risk healthcare workers. Additionally, long-term care staff and residents are prioritized to receive vaccines. Vaccinations at our nursing homes, adult care homes, and other long-term care settings are being managed by the federal government. However, the vaccines used in those long-term care settings will come from our state's vaccine allotment. We hope that by January, our health departments and community health centers will start vaccinating other high-risk adults who are at high risk for complications, meaning they have 2 or more chronic conditions and are at higher risk for exposure. The key takeaways are that vaccines will initially be available in limited settings, primarily focused on our hospitals across the state and then our long-term care residents and staff. As the governor said, the vaccine will be free to everyone, and any fees associated with administering that vaccine will be paid by either your insurance company or by the government. We've been hard at work preparing for this moment. Our vaccine plan outlines the critical steps needed to administer a vaccine program of this scale. Anything from enrolling providers to give those vaccines, to ensuring that the vaccines are distributed equitably and providers can properly store and handle them, to developing an IT system to manage vaccine supplies and ensure that people get both doses of that vaccine, training providers on how to use those IT systems, to have that process to monitor for any adverse reactions, and so much more. States are going to need ongoing federal support and federal dollars as we undertake such an unprecedented effort. Having a safe vaccine within reach is an extraordinary achievement, but at the same time, it is not a quick fix. It will take several months to have enough supplies so that anyone can readily get a vaccine. Until most people are vaccinated, those 3 W's remain our best tool to protect our loved ones, to make sure our hospitals are there for those who need them, and to save lives. So, whatever your reason, get behind the mask. Thank you, Governor.
Thank you, Dr. Cohen. Appreciate your hard work and the work of your staff. As the states are shouldering the job of vaccine distribution, We need more support and resources from Washington. I know Congress is facing a deadline this month to keep the government running. I implore them to do more to support families and small businesses, as well as the states, which must create networks for vaccine distribution. Within the next few weeks, there will likely be at least one approved vaccine. And with hope so close on the horizon, we have to keep using the tools we know slow the spread of this virus to help save lives during the next few months. Don't give up now when help is on the way. Wear a mask. If there's ever a question about when we should put on a mask, err on the side of wearing it. It's an easy way to protect our family and our neighbors, and it actually helps boost the economy. When we all wear our masks, we help keep businesses open and customers and employees safe. Practice social distancing. Anytime we leave the house, anytime we are near people we don't live with. These simple measures do save lives. I also appreciate the continued efforts of local governments like the City of Asheville, Buncombe County, City of Winston-Salem, that are increasing enforcement of our existing strong orders. This enforcement, along with more local governments getting on board, can bring our numbers down and keep us from having to go backward. Again, don't give up now. We need to work together and stay vigilant. If we do, I know we'll get through this. Also with us today is the Director of Emergency Management, Mike Sprayberry, and Commissioner of Prisons, Todd Ishii. Monica McGee and David Payne are our sign language interpreters, and behind the scenes, Erica Kugler and Jasmine Mativier are our Spanish language interpreters. We'll be glad to take questions, and if you can identify yourself and your organization, we would appreciate that, and we'll take the first one.
Our first question is from Reuben Jones with Spectrum News.
Yes, good afternoon. This is Reuben Jones from Spectrum News in Charlotte. Governor Cooper, you just praised some of the specific counties for putting in place tougher restrictions around the state. I wonder, with the projections that the numbers are not going to be going in the right direction following Thanksgiving over the next week, do you expect the state to put in place any new restrictions in the next week?
We will do what we need to do to protect the safety and health of North Carolinians. All options are on the table. But look at what we have in place now. We have a very strong, fortified mask mandate. We have capacity restrictions and rules in restaurants and retail stores. We have mass gathering limits. We have all of these protocols that are in place that are designed to slow the spread of the virus. And if people will abide by those protocols, if local governments, law enforcement, and others will help us enforce those protocols, we can avoid having to go backward. But we will do what we need to do to make sure we've got hospital capacity and ICU capacity, and to make sure that when somebody has a heart attack or appendicitis, that there is a hospital bed and surgeons and nurses ready for them. And already we have seen hospitals strained significantly in other states. We do not want that to happen here. Next question, please.
Our next question is from Paul Wolverton with USA Today Network.
Hi, Governor, it's Paul Wolverton with the USA Today Network. There was a rumor last week that you were considering a curfew possibly for 9 p.m. statewide. Was there any kind of a curfew under consideration?
We've continued to look at all options in order to reduce the spread of the virus. Some other states have done that, and that's certainly an option that is on the table. As I mentioned earlier, we have a lot of protocols that are in place right now that we believe, if people abide by them and if we can get them enforced, can help us slow the virus sufficiently, but all options are on the table. Next question.
Our next question is from Robin Kennedy with Fox 46.
Good afternoon, Governor. This is Robin with Fox 46. Will teachers, school staff, and first responders get priority in receiving the vaccine?
So we've had an independent advisory committee to help us with guidelines and who comes first with the virus. Healthcare workers who are on the front line, people with severe illnesses or that could be severely ill with COVID, and those with chronic conditions come first. We know that we're going to get limited supplies at first, but I'll let Dr. Cohen address a little bit about how the protocols were set up. Dr. Cohen.
Thank you, Governor. Hi, Robin. Yes, as the governor mentioned, and I mentioned earlier in my remarks, we had an independent vaccine advisory group that was convened by the Institute of Medicine here in North Carolina, brought together a lot of experts from around the state, and they did make recommendations to us. We also aligned those priorities to the National Academy of Medicine, which did also put out a set of protocols for prioritization that we have been using. As we look into the future, the governor said we are going to have a limited number of vaccine available. So the first folks that are going to see that vaccine are going to be our hospitals in order for them to vaccinate their healthcare workers that are at high risk for exposure, those that are caring for or clean the areas of folks with COVID-19. As we get more vaccine, we'll be able to share that with even more hospitals. Again, focusing on our frontline healthcare workers who are at high risk for exposure. Additional priority groups include our long-term care, both residents and workers. Those are folks in nursing homes, adult care homes, and other long-term care settings. So they will be prioritized. In addition, it will be adult after that. It'll be adults with 2 or more chronic conditions that put them at higher risk for severe illness for COVID. Things we have been talking about related to heart disease and diabetes. So those are the kinds of chronic conditions that we're going to want to seek out. So if someone is a K-12 teacher or a firefighter and they have 2 or more chronic conditions, they are going to be prioritized after we do our healthcare workers and long-term care workers. That will be the next group that will be in line to vaccinate. I would caution that will probably not be until the January timeframe for that group, again, because we're starting with our hospitals, healthcare workers, and then moving to our long-term care settings. Thanks.
Thank you. Next question.
Follow-up, Robin Kennedy, Fox 46.
So beyond the initial folks that you just mentioned, the healthcare workers, the long-term care facilities, and then those with chronic conditions, have you made decisions beyond that on who will be the next group?
Dr. Cohen, I'll let you.
Hi, Robin. Yes, we have a full prioritization that is included in our vaccine plan that we submitted to the federal government. It is posted on our website, but we are really focusing on those groups, and we want folks to, most importantly, understand there's going to be a limited supply at first. We're going to focus, like I said, on hospitals, healthcare workers. Then we will move to working with our local health departments to make sure we're getting all of our healthcare workers that are working with COVID patients, and then to our long-term care providers. So that's what we're going to be. We just want to make sure that folks are understanding that first. So limited supply at first. Few folks will be prioritized, but we do have a full list of prioritization that is included in our vaccination plan. Thanks.
Another thing that's important is that we want people to get vaccinated when it's your turn. We have some concerns about people not wanting to be vaccinated, and if it is authorized by this independent advisory board and approved by the FDA, I have confidence in it. I think most of our healthcare and health experts will have confidence in it. We want people to have confidence in it because in order for this to work, we need to get as many people vaccinated as possible. Next question, please.
Our next question is from Amber Lake with WITN.
Hi, Governor Cooper. This is Amber Lake with WITN in Greenville. I was curious, in Eastern North Carolina, we have had some very high-profile infections, like the Pitt County Health Director, Dr. John Silvernail, and the most recent one is the Farmville Mayor, John Moore. Do you think that Pitt County and other ENC counties need to do more in the fight against COVID-19?
This virus does not discriminate. Anybody can get it, and anybody can transfer it from one person to the other. There is community spread across the entire state of North Carolina. I'm not sure where Pitt County ranks right now, whether it's yellow, orange, or red, but every single county in North Carolina right now has cases and is at risk. So we want everybody to do more, not just Pitt County. We want local governments, law enforcement, businesses, leaders in the community. We want people to set an example about what they can do right now to reduce the number of people getting sick and dying, and to reduce the number of people who are having to go into our hospital and take beds. And we know the way to do it, to wear masks, to social distance. Those are the things that we know work right now that cost very little, that can help us get through this until we can get enough people vaccinated. Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. We talked back in early November, your hopes about trying to see if the politicization of wearing masks and things like that would go away post-election. Here we are, close to a month out. And I was just trying to get a sense for what you feel like you can say to people who are declining or refusing to wear a mask that hasn't already been said that you think might be able to get them to start adapting to it.
I think to say that we're all in this together, and that wearing a mask is not for the person wearing the mask as much as it is caring about people who are around you. I think more and more people are beginning to understand that the science is very clear on this, that masks do indeed help reduce the spread, and they're most effective in protecting the people around you. The mask does provide some protection to the person wearing it, and that data has come online, and we're seeing that more and more. But more importantly, it protects people around you. And I think it shows, for people of faith, you want to look after your neighbor and look after each other. Wearing a mask is one of the best things that you can do to show that you care about them, because you may have the virus and not know it. You may have it and not have symptoms. You may have it and not have any symptoms. And we know a lot of people, almost half of the people, may not have any symptoms at all. So I think it's an appeal to everyone who cares about their neighbor, who cares about their family, that this is something that is important to do. Next question, please.
Follow-up, Richard Craver, Winston-Salem Journal.
Yes, Governor, I had a follow-up question. And not to sound overly negative in this instance, but also y'all are expressing a lot of confidence in the vaccine that hopefully will be out in the next few weeks. Is there any concern that y'all may be found yourself in the category of overstating how effective this vaccine can be, since it's still so preliminary?
I'm going to turn it over to Dr. Cohen on that.
Hi, Richard. So we have gotten a look at some preliminary data from both companies, Pfizer and Moderna, that have already submitted some of their scientific data to the FDA. And again, those are just some preliminary initial looks, but what they are showing is that it does prevent folks from getting COVID at very high rates, higher than I think we were initially expecting. The FDA had set a marker saying we want to see at least 50% of infections prevented. And what the two vaccines, at least with this preliminary result, is showing closer to 90%. Now, I want to see all of that data, and I know the FDA is working to make that publicly available as they work with their independent advisory committee and that meeting that's going to be happening on the 10th. So I'm looking forward to looking at the deeper details of that data. I think the thing that has been reassuring to me is that the scientists that I respect, that I know have seen more of the data than I've been able to see at this point, have all said that it is very positive. So we look forward to seeing more of that data. And again, vaccines are really only as effective at preventing COVID if everyone gets vaccinated. We can have these great tools, but we have to use them. And so our focus at the state is making sure that we can hit the ground running and that we can make sure that we're sharing good information with folks so they can make good decisions about getting vaccines when it is their turn. Thanks.
Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. You said that North Carolina is prepared to receive the Pfizer vaccine that requires ultra cold storage. Why Pfizer for our state? Is it because of our cold storage capabilities? And with the limited supply, is there a specific number?
So the Pfizer vaccine is the first one that requested authorization. So we think that the Pfizer vaccine would be first, and we do know that that requires ultra cold storage, and a number of our hospitals already have that capability. 84,800, I believe, is the number that we have been told in the number of doses that we would receive with the first shipment, and that's what we are expecting at this time. Dr. Cohen, would you like to add to that? Okay. Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for the follow. With the subsequent shipments and the timeline, is Dr. Cohen said by January, hoping to be able to offer vaccinations for the 2 or more chronic condition adults. Is it by early January? Is this all depending on FDA approval, what time of the month it is, and when the next batches would be delivered?
Go and handle that.
Hi, Dawn. So the best information we have right now from our federal partners is, as the governor mentioned, about 85,000 doses will come to North Carolina when the first vaccine is approved. Now, there'll be a second vaccine, we think, coming right on the heels of that, and then that will be a second allocation. The federal government intends to do weekly allocations of the vaccine. We do not know at what level and how many doses we will be getting on an ongoing basis. So it's hard for us to pinpoint exactly when we will be able to expand beyond our healthcare workers and our long-term care settings into that next population of our adults with 2 or more chronic conditions. So we know that when we get the first vaccine, it will be going to hospitals only. We'll be focusing on healthcare workers only. That's that first 85,000 doses that we're expecting. Again, the FDA has not yet authorized use of this vaccine, and things could change. They could alter the way in which that approval goes forward, which may change our numbers, but that is what we are planning for at this point. When we have a second vaccine, then we'll be getting weekly doses of both vaccines, and then we will work through our populations that we have prioritized. So I can't say quite yet about when we could get to those adults with 2 or more chronic conditions, but we believe it will probably be in the January timeframe. Thank you.
Thanks. Next question, please.
Our next question is from Eddie Garcia with WFDD.
Thank you for taking my question, Governor. This is Eddie Garcia from 88.5 WFDD. Forsyth County is reporting a test positivity rate of 20.3%, yet the state data is showing 9.5%. And our county officials say this could be because the data is scrubbed, so only county residents are included, and that the state might be including non-residents. So I'm wondering why there's been this disparity between the numbers, because it's been happening for a little while now, and the gap seems to be widening somewhat dramatically. So how does DHHS account for this, and which of these numbers really should be used for the county alert system, Matt?
We know percent positive is an important data point that we look to determine where we are in the spread of the virus, but I'll let Dr. Cohen address that issue specifically.
Hi, Eddie. As we've been talking about for a number of weeks, we've been concerned with the level of viral spread in the triad. And so I think what we are seeing in Forsyth with a higher percent positive is the fact that they have more viral spread in that county. The way we calculate those numbers is we do include the lab tests that are done by folks that are from Forsyth County. So if we, for all of North Carolina as a state, we take everyone in the state who, where we get that information reported to us electronically. For Forsyth, then we take just that information of those that live in Forsyth and we calculate that number. What I think it shows us, as we said, is that there are different levels of viral spread across our state. But as the governor emphasized earlier, we have high levels of community spread across our state. Whether we've labeled someone a yellow, an orange, or a red, that still represents a significant amount of community spread of this virus. So there are important actions everyone needs to take, but I'd really emphasize that places like Forsyth with a high percent of tests that are positive, meaning that as we test folks, a lot of them are coming back positive. It means there's a lot of virus in the community, and there are things we need to do right now. Let me give you a couple of items that folks should be doing when they see higher levels of viral spread in their communities. First, they need to be limiting their social circles. So not just having small events, which you are required to do by executive order, you don't want to mix with too many other households. Every additional household you mix with is one additional exposure. So you want to be limiting your social circles. Thinking about, instead of dining in at a restaurant, consider getting takeout instead. Those are the kinds of things that you can take modifications. Everyone should already be wearing a mask. Everyone should already be social distancing and doing small gatherings and following the safety protocols. But there's some additional things that some of our counties, particularly that are red and are orange, that need to be going even above. And I'm particularly concerned about our triad because of some of the strain we have seen on their hospital systems already. Thank you.
Next question, please.
Our next question is from Dewan Hogard with ABC 11.
Hi, good afternoon. Dewan Hogard here with ABC 11. First question for Dr. Cohen. You all seem to be pretty confident that at least by January you'll have enough doses for more folks. Are you under the impression or the assumption that these first doses will arrive by Thanksgiving or at least by the end of the year? And then secondly, once these folks do receive their vaccinations, or for anyone who does, do you see the mask mandate, if that will be relaxed in any capacity?
Thanks, Dewan. So as the governor mentioned, that there are 2 vaccines at the FDA right now that are going through the approval process. The earliest that we expect a vaccine is probably in the middle of next week, December 15th, 16th, 17th, something like that. And so we expect to potentially see approval and potentially have vaccine by the end of that week. Again, it's going to be in limited supply and only at a limited number of hospitals to start with. But then we expect to get allocations from the federal government week over week. And then there may be a second vaccine that will be approved before the end of this calendar year. We can't say for sure, but that's what the schedule looks like at this point. And there may be a third or a fourth, because we know there are other vaccines actually in the pipeline that may make it into the FDA approval process. So that is why we're not able to give an exact understanding of what group exactly when, because we don't know how much vaccine we'll be receiving here at the state, nor how many vaccines will be approved and what the available vaccine quantity will be. I will say that we will need to be wearing masks as we work our way of increasing the amount of vaccination happening in our state. So masks are going to be with us, particularly as we think about celebrating Christmas and New Year's. Masks are going to be incredibly, incredibly important. We're already seeing such a high level of viral spread here. We all want to make sure that we are planning for small gatherings this year. You're going to hear us talk a lot about how to prep for the Christmas holiday and the New Year's holiday differently this year, but masks are certainly going to be part of that. Thanks.
Your question brings up the point about how complicated this vaccine distribution can be. Not only do you need to make sure that you get the vaccine to the right people, but then with the first 2 vaccines that we expect approval for, there are 2 vaccinations that you need. One is at 21 days apart. So you have to make sure that the person comes in and gets vaccinated a second time 21 days afterward with the same type of vaccine that they got the first time. So this distribution process is going to be complicated, but that's one of the reasons that the department has been working on this for so long, and we look forward to getting these vaccines out and helping people. Next question, please.
Follow-up, Dewan Hogard, ABC 11.
And thank you for answering that. As the state is seeing more viral spread, this weekend we're expecting about 100 youth soccer teams from around the country to participate in a tournament here in Raleigh. So given the number of rising cases in both this state and across the country, are either of you concerned about this event and its potential impact on the community here?
I would certainly be concerned about it, and we need to make sure that people abide by mass gathering limits. People need to be very careful when they're gathering together. Dr. Cohen, would you want to say something? Hold on a second.
Hi, Dewan. Our guidance already discourages tournaments like the one that you are describing. But if folks are playing these kinds of sporting events that are of intermediate risk, like soccer, they are required to be wearing masks while they are doing it, both playing on the sidelines and the fans. So masks are going to be an important component to add an additional layer of protection. But as I said, our guidance already discourages those events. Thank you.
Next question, please.
Our final question is from Travis Bain with WRAL.
Yeah, thank you. A lot of this tiered distribution plan depends on how many comorbidities people have. Who's responsible for establishing that? And I'm particularly wondering, in the hospital, is that hospital administration? Is that the individual worker's personal doctor? How does that work?
Hi, Travis. As far as how do we decide what are the 2 chronic conditions, it has to be something that is specific to COVID, and that has been established by the National Academy of Medicine as well as the CDC. It is that same criteria of the kinds of chronic diseases that we've been talking about. So it's not any chronic disease, because there's a lot out there, but the ones that are focused to COVID. You can find that in our vaccine plan. We do list out specifically what we're talking about when we say 2 or more chronic conditions related to that. Oh, and then I think you asked about related to hospital workers and such getting vaccines. So when our limited supply comes, and we do share that with our hospitals, it will be those that both care for those with COVID as well as cleaning those areas. So it'll be both the clinical staff as well as others who may be in close contact with the virus itself. So it could be clinical workers or those from the janitorial staff as well. And again, we leave that up to the discretion of the hospitals to make sure they are prioritizing those that are, again, at high risk of interacting with the COVID-19 virus. Thanks.
Here's a follow-up, Randy.
Oh. Yes, Travis.
Yes, I wanted to make sure. So is it self-reported then that, hi, I have these 2 comorbidities and thus qualify, or do you have to have a doctor's note? How does that actually get policed?
Yeah, Travis, great question. So it will be self-reported, so it will not require a doctor's note. But again, we are asking folks to abide by the guidelines that we are going to be put out, but it will not require a doctor's note. Thank you.
I want to thank everybody for joining us today. Please abide by the 3 W's and stay safe out there. Thank you very much.